Model dictation. Honorable members, ladies and gentlemen, I am really happy to welcome you all to the 15th meeting of the Family Welfare Board. I am grateful to the Government of Tamil Nadu for their kind invitation to hold this meeting in this beautiful city of Madras. This morning, I would like to reiterate the vigorous possible family planning program pattern has been issued. The new pattern now proposed for the different states has emerged from the suggestions based on the experience which you have acquired in the past in developing this program and is the natural development of the program started in the successive 5-year plans. At this particular period in Indian development, the excessive growth of population is the most serious threat to our plans and aspirations for economic growth, defensive strength, and development of social welfare such as health and education. We all know too well that each year, by great effort at all levels, we have been able to raise our national income by a certain percentage. The per capita income has increased to some extent. The little increase in income provides the critical leverage which allows us to invest in new and more predictive and remunerative industries and thus carries us to the road to economic strength and self-sufficiency. However, each year a substantial portion of the rise in national income has been virtually neutralized by the excessive rate of population growth. In other words, the hard-earned growth factor has had to be committed to providing food, clothing, and shelter to additional people at the same level of living as before without raising their standard of living. In spite of many difficulties, we have been able to make remarkable progress in industrial development. But the rate of national income is not at all in keeping with the rate of population growth. There is also a gap between national and per capita income. The standard of living of some people has gone down instead of going up. We are squarely faced with the fact that the rising increase in population growth threatens to nullify the fruits of increased production. At this critical juncture, we as citizens must recognize and accept the challenge of accelerating our family planning promotional activities as widely as possible. We are obviously concerned with the whole spectrum of health measures. At the same time, we must understand and realize that family planning has the most far-reaching consequences on the health of the nation. So, the priority for family limitation by reducing the rate of population increase is not determined by individual preferences. It is determined by the need to preserve and build the nation as a whole. I have till now referred to the need for family planning in economic terms. Its relationship with health programs, both curative and preventive, needs no elaboration. As a result of our introducing many life-saving medicines and adopting modern methods of treatment, the death rate has been considerably reduced. On the other hand, the birth rate remains unchecked. As long as the population growth grows on at present pace, all our efforts at disease control and at the present pace, all our efforts at disease control and provision of medical relief will be of little avail. This aspect of the matter has to be very clearly understood by us as it relates to the health of the nations as a whole, and we cannot afford to neglect it under any circumstances. The success of the family planning program will largely depend upon the full and integrated use of network of various types of skilled health and development worker. Such worker should reach the people with continuous educational activities. It should also be their duty to render all assistance to those who are willing to limit their families. This will involve use of the types of public information media and also mobilization of other development departments. When this progressive program success, a stage will be set for the successful implementation of many other health programs and services such as nutrition, environmental sanitation, etc. The government of India are prepared to give the fullest support to the streamlining of family welfare administrative and educational services in order to meet the immediate threat to nation posed by excessive population. If the health officials and others in this field truly accept this challenge, they will at the same time be helping in acceleration the development of the overall structure of health services at a far more rapid rate than could otherwise be expected. As health workers, we should get rid of narrow ideas about the scope of health programs. We should so that we can relate our efforts to the overall priorities of national development. Thank you.